Immediate mandibular molar implant with MIS implants and Maxxeus bone allograft and pericardium. Presented by Dr. Dan Holtzclaw. Shown here is a pre-surgical radiograph of a hopeless mandibular first molar. The tooth was treatment planned for extraction and replacement with an immediate implant. Seen here is a sectioning of the tooth for atraumatic extraction. Note the well-preserved bone following atraumatic extraction of the tooth. Placement of an immediate dental implant into the extraction site is shown here. Maxxeus bone allograft was packed into the extraction socket around the dental implant. A Maxxeus pericardium barrier membrane was carefully trimmed to fit around the healing abutment of the dental implant and cover the Maxxeus bone allograft. A hole punch in the pericardium was utilized to allow the implant to be exposed. Primary closure was achieved. On the screen is the radiographic sequence of immediate implant placement. Pictured is healing at 6 weeks. Note the health of the gingiva around the implant. This is an excellent pre-sign of a successful graft. Radiograph at 6 weeks healing shows how the Maxxeus bone graft is still intact around the implant and shows great signs of remodelization. Note the health of the tissue around the head at 10 weeks healing. The Maxxeus pericardium has incorporated nicely into the host tissue. ISQ testing at 10 weeks revealed a value of 78. The implant was now sent to the restorative dentist for a final definitive restoration. The radiograph at 12 weeks, when the implant was sent for final restoration, still shows how the bone is remodeling nicely into host tissue, and the height of the graft hasn't had any recession around the implant. Presentation by Dr. Dan Holtzclaw, Lone Star Periodontics and Dental Implants, Austin, Texas. For information on Maxxeus brand allografts, visit www.maxxeus.com.